Hi everyone, and happy World Family Doctor Day. Welcome to this edition of Family Medicine on Air. Thanks for joining us. I'm Crystal Foster, a recently graduated fourth-year medical student at the University of Missouri School of Medicine and Region 2 coordinator for the National FBIG Network. Before I introduce our featured speaker on today's topic of global health and family medicine, I want to remind those of you watching live Google Plus that you can use the Q&A feature to submit questions during the Hangout. We'll get to those answers at the end. The American Academy of Family Physicians and the Family Medicine Interest Group Network bring you this live social media series to give medical students across the country a chance to learn about hot topics in healthcare directly from leaders in family medicine. In addition to today's live broadcast, this video will be archived on the FMIG Network's YouTube channel, and we have some additional resources and information we'll share with you in a little bit. And now, I'd like to introduce our featured speaker for this episode. Kyle Hodebeck is a new family physician working in North Carolina. In addition to his clinical duties, he serves as chair of Polaris, the North American New and Future Family Physicians Movement, and is an assistant professor of family medicine. He is widely published internationally in over 10 countries, has given over 60 international presentations, and has provided patient care in obstetrics, tropical medicine, and even a leper colony in South America. Speaking Spanish, Portuguese, and Guarani, he enjoys traveling and teaching overseas. I'll turn things over to Dr. Hodebeck to tell us what med students need to know about global health, and then come back with a few questions submitted by your fellow medical students.
Hi, Crystal. How are you doing today?
Excellent.
Wonderful. So again, to you and to everybody watching out there, happy World Family Doctor Day. This day is actually the 5th year that we're celebrating this, and basically it's for all family physicians, family doctors, general practitioners, whatever primary care physician calls themselves around the world. It's your day, so congratulations and enjoy your day. So again, my name is Kyle Hodebeck. I'm a family physician. I've been involved in and interested in global health well before medicine. I was an Army brat, which just means my parents were in the military. We moved around the U.S. as well as to Europe and back several times. And so this has always been a lifestyle that has interested me. During undergrad, I also did some international experiences, and as I moved into the medical realm at medical school, I wanted to continue those experiences because I found that helping other people here as well as abroad is just something that really fulfills me as a person and as a professional, as a physician. Some of my specific experiences would be doing rotations in southern Spain, doing rotations in southern Italy, as well as working in Paraguay, Mexico, Argentina, as well as Brazil. On one of those trips, I also met a lovely young lady who, after 2 years of dating, became my wife, and that also brings a nice international flavor into the home as well. Also accounts for a lot of the languages that I speak as well. So having that international context, not only professionally but in the home, is very important to me, and it's very important that I apply this knowledge and experience that I have to better not only myself as a physician, the care I give my patients, but to help those anywhere that I can. Going on into residency, I further also went into other locations in order to do similar sorts of experiences. One that you mentioned was a leper colony, and one of the coolest things I like about family medicine, as well as global health, is a lot of people only read, like when you're a medical student, you read about leprosy in a book, but I never saw leprosy until I went and actually treated patients. And it was quite the experience. So it goes beyond a book. Being a doctor goes beyond reading about it. You need to go and experience it. You need to touch it, treat it, and have that ingrained into your mind. So those are the different types of things that really push me into global health as a family physician. I think that our specialty as family medicine is really made for global health. The WHO, the World Health Organization, time after time after time, really emphasizes and focuses on family medicine because you know what, we do it all. We get help from our specialist friends, but we take care of 80 to 90% of pathologies and prevention and wellness out there. So family medicine is so important in global health in general. So that was one of the main reasons, because I had that interest in global health, I actually went into family medicine because of that specifically. Additionally, family medicine is about relationships, so is global health. You have to form these, you can't go into another country and start treating people. You can't just do these things. You need to form these bonds. You need to form relationships with these people. It's the same thing we do in our clinic every single day. It's not just the patient. It's not just patient X, patient Y. It's Mr. Jones, Mrs. Smith. They're a person to you. And then you're also not just Dr. X or Y. You're a person to them. So in my opinion, a real family doctor really treats their patients like their family as well. If you can take that to the international level, that's global health. So that was, in brief, my experience with global health. One point before we go on into the questions, I'd really like to touch on, so I know we're looking at medical students who may be interested in global health as well as family medicine. An opportunity that I wish I had when I was a medical student is something called Polaris. And with the help of our Canadian, American AAFP, as well as Caribbean colleagues, we have our North American Junior Family Physician Movement. And basically, we represent Canada, the U.S., and the Caribbean, not only within our region, but we represent ourselves to the rest of the world. It's a great platform that we use in collaboration with AAFP and various other organizations in order to improve opportunities for medical students, as well as residents and young physicians like myself. But definitely, we want to get medical students involved. I believe there are 7 of these type of organizations around the world, and we're the only ones who really focus on getting the medical student involved early on, so that we can show you exactly what global health is, what family medicine is, and let you fall in love with it, just like we fell in love with it as well. Crystal, what questions do you have?
Thanks, Dr. Hodebeck. I do have a few questions. You kind of answered the first one. We had a student comment that they'd like to hear more about how family doctors are uniquely equipped to serve as global health doctors, and you answered that really well. I just wanted to share their comment. They said that they think too few students interested in global health actually recognize that family medicine is ideal for global health training. And I think you touched really well on that question for that student. We had another question, a little bit more specific. So as an aspiring family and community physician, do you think I will be well equipped to learn about and practice the prevention, diagnosis, and treatment of infectious diseases in the international setting of limited resources? Do you also think I will be well prepared to manage childbirth and its potential complications in these settings? That is, can I address these important aspects of global health without becoming an ID specialist or obstetrician?
Sure. So definitely there are diseases out there that we do not see a lot here in the U.S., whereas a lot of other family physicians around the world do see. For example, working as a family physician down in Paraguay, I would see malaria, I would see dengue. You don't see those here, right? So if for someone who does want to have a specialty in global health or interest in global health, obviously there is some more knowledge that you need to gain based on the location that you're going on. So the same information is not going to be applicable to Sub-Saharan Africa as to India, as to Australia, as to the middle of Amazon, right? So you do have to read up on that specific location. So family medicine in general, yes, gives you a great base. You do need to study up on the specific diseases that are going to come into that clinic at the location you're at. So so my answer is yes, it does give you a good base, but you can't stop there. You've got to keep going and learning about the specific population and the diseases and pathologies that affect that population.
Thank you. We've got a couple more questions. How can we get involved in global health during medical school if our school doesn't have a global health program? I know you mentioned the Polaris movement, but are there any other resources that are available?
Of course. There's we're blessed here in America to have tons of resources and a lot of support within AAFP, SCFM, you name it. So a couple of resources. So the AAFP Global Health folks, they promote global health. So that's a section of AAFP that promotes that. We have a global health workshop coming up in the beginning of October. So that is in Denver, and that would be a great way to get involved here in the U.S., but we're having international folks meet there. For medical students, I would also recommend on the 1st of October, the day before, there's the Polaris Pre-Conference that is attached to that Global Health Workshop, and there specifically will be folks from Canada, U.S., and the Caribbean, but also other junior physicians and medical students and residents from over a dozen other countries as well. A couple other things. Let's see. There's the International Federation of Medical Students Association, and they have a lot of international exchanges and contacts. And last time I read, it was 119, 120 different countries. So there's a lot of different places you can go to there. And what else? There is the for AFP, the Directory of Residencies that have international components. So that would be through AFP and looking towards residencies. However, I do know that a lot of them also will accept medical students who are interested in getting involved as well. So there's a couple things that are available out there.
Thank you. Another question that we had is, some med students want to do global health but are worried about language barriers. So what advice do you have for them?
Okay. A couple of options out there. So obviously, many countries do not speak English. So if you have a second language or learned Spanish in high school, even if you forgot some of it, it'd be a good way to apply that. If you just don't speak any other languages, got it. So some options are locations that have English as one of their primary languages. So you can try like Australia, New Zealand, many countries in Africa, Nigeria, English is one of their primary languages, as well as many other countries throughout the world. One thing we also have to remember is medicine in general, not 100%, but in general, the language of medicine is English. So we're a little bit lucky there. So most physicians will have at least a basic, if not really good, understanding of English. So in my experiences overseas, especially in Europe, with a lot of our colleagues around Africa, Asia, Middle East, South America, you name it, English they're spoken very well. So finding at least a contact that speaks English, whatever area you're interested in. So that would be one thing. Look for areas where the patients potentially will also speak English as well. And then the other thing is maybe you can travel with somebody. So if you have a medical student buddy who speaks that language, you have your personal translator right there. So that would be the other option as well, as far as language barriers go.
Thank you. Or I guess you could just learn a bunch of languages too, like you have.
That's a much longer option.
Another question that we deductions while we're abroad helping others.
Okay. So this advice goes for pretty much anybody traveling overseas, or even in dangerous parts of our country. I would recommend. Don't travel by yourself. In general, if you can go on an exchange with a buddy, your best friend, someone you really respect, you always have your pair there with you, and then you can look out for each other. That's a great way to start, and then it's also fun to share those experiences with somebody else. So going on that trip with somebody else, stay away from. I would ask the doctor or whoever that is hosting you, where are places not to go and when, and a lot of people will let you know that information. And then obviously you don't want to travel down dark alleys at night by yourself, just asking to get into trouble. So don't just be smart and travel daytime, have a buddy, and stick to safe locations within that country.
We might have time for one more quick question. This one's pretty important with medical student loans being so expensive. Can medical students right after they graduate or during residency or after residency practice? Is it financially feasible to practice global health right after residency?
Sure. So again, it depends on exactly what you're hoping to do. But for example, I'll give an exchange for an example. There are a lot of exchanges that we do with other young doctor movements around the world. So that includes medical students as well, medical students, residents, and junior physicians. A lot of these you will actually can be hosted in that person's house, so that saves a lot of money as far as expenses from hotel, things like that. So if you can have an experience for 2 to 4 weeks and you're staying in someone's home, and then return the favor either to that person or somebody else, that makes things a lot easier. And I think it's actually a lot better experience because you're seeing how that doctor actually lives. You're not in some hotel somewhere, not experiencing the life. So I think, in my opinion, not only is it cheaper, but it's actually the best and proper way to go experience these things. So that's one way. Obviously, looking for plane tickets or whatever methods of getting there at the lowest or non-peak times of the year work as well. Sometimes if you can combine like a exchange with a conference, that's one way to do it. So you get 2 for the price of 1, if you will. So there's a lot of those that go on in Europe, and South America just had one in Uruguay. So they had like a 2-week trip or exchange, and then we had our conference. So you're still, shelling out the money to get there. However, you are staying with a medical student or a resident, so it makes things a lot cheaper. So you are going to end up spending a little bit of money at a minimum, but the experience you get out of it, it's so worth it. So look for every way you can save money, and whenever it's out there, take it. But I definitely would. I've spent thousands of dollars on all my trips, and I would do it all over again in a heartbeat. So despite those loans.
Thank you, Dr. Hodebeck, for sharing these tips about global health with us and for helping us celebrate World Family Doctor Day. Got a couple more resources I'd like to point out to you all before we end this episode. So if you'd like to learn more about global health or any of the resources that Dr. Hodebeck mentioned, head to aafp.org/fmonair. We also hope you'll join us for more episodes of Family Medicine on Air and check out past episodes on direct primary care, the patient-centered medical home, and more at aafp.org/fmonair. Thank you, Dr. Hodebeck, again, for being today's featured speaker, and thanks to everyone for listening in.
Thank you.